to be attractive without drawing negative attention. So that's another thing to think about when choosing the size of your breast implant. I want you to look good, but I want you to look natural.
Yeah, because my husband has a daughter who's quite heavy, and she has a huge bosom.
Right.
And, you know, her mother and her grandmother's offered to pay for breast implants, or breast reduction is what the girl needs. She doesn't want to give up 20 pounds. She's just so big, and I hope you don't mind, but she's so big that she just cannot, you know, drag herself around. It hurts her back. She has bridges on her shoulders and everything.
Well, breast reductions in situations like that are often covered by your insurance.
Really?
Because it
affects her back and everything.
Absolutely. Breast reduction is a proven way to improve complaints in the lower back, upper back, and neck. So if a woman has chronic pain in her shoulders and her neck or her back and has large breasts, the breast reduction could be a treatment for that. And that is covered by your insurance.
Now, I guess most of these procedures are not covered by insurance, healthcare insurance. Most of them are not.
That is
well, you know, I agree with that, don't you?
It's a choice.
It's a choice,
The insurance is to help with illnesses that are affecting your function. And most of the things we're talking about for cosmetics don't affect your function. They affect how you feel about yourself, but not directly affect the way your body functions. So it is
your self-esteem, you know, is usually a lot of reasons why we as women want to look our best.
Right. Absolutely.
Yeah, I make up just right and this and that. But there's a lot more going on inside of someone who chooses something. Do you ever kind of psychoanalyze them before they go under the knife with you?
Well, I'm not qualified to do that, but you know, I can ask patients, you know, what their motivations are. If I think the motivations are unusual, or if I think that their goals for the surgery are not realistic. So if someone wants to have their breast augmented because they're having trouble in their relationship, that's not a realistic solution.
That's not going to give you a good relationship, is it?
Right.
Or get you a new boyfriend.
Solution. No. If someone wants to have a tummy tuck because they're depressed, then that's not a realistic solution. Not to say that, you know, you can't make that decision to have that, but don't expect it to be a cure-all.
No, I don't think any kind of surgery is a cure-all.
No, it's not.
Even pills.
No, absolutely not.
Everything just wears off, you know. I'm not trying to say everybody should do my thing, but I try not to get involved in the pills and alcohol and all that kind of stuff. Because I have to know what I'm doing, Dr. Banks, every minute of every day. And I'm responsible for myself and what I do. So, but not everybody's like me, thank God. What is your favorite procedure? I guess I shouldn't put you on the hot plate.
My favorite procedure, reconstructive or cosmetic?
Oh, both. What's your feel? Yeah.
My favorite procedure in reconstructive surgery is ear reconstruction.
Ear what?
Ear reconstruction.
What is that?
Making an ear for someone who doesn't have one.
Oh my goodness, that's wonderful. How do you do that?
It depends on the patient, most often with cartilage that comes from the ribs.
From the ribs? Oh my goodness.
Because you have to replace the cartilage that came from the ear. That's my favorite.
What is this caused by? Are they born without it?
Some people are born like that. It's called microtia or anotia, which is a small ear or missing ear.
The whole ear?
The whole ear parts. Usually there's a remnant that's left. Usually there's part of the ear that's left, but it's not a normally shaped ear.
Okay.
And then the other most common thing is accidents, car accidents and assaults. Sports accidents.
Right. Because I just did a calendar a few months ago, and I have an organization called Awakening Women. I work with women in domestic violence. And one of the women, it just so happened that her boyfriend came in while she was in bed, and he poured lighter fluid on her right ear. And he set her on fire. And she lost a lot of her hair and also top of this ear right here.
Right.
But we managed to find someone to, I wish I would have known you then. We found someone to put her ear back together.
Burns is another big reason that people need an ear reconstruction. I've actually found a good
I would
person to
imagine the
help her.
whole face so badly disfigured. Do you do that as well?
Burn reconstruction?
Yeah.
We do some. A lot of that is done in larger centers. I really focus on the ears.
Just the ears? Because like Michael Jackson, I kept thinking when he had that Pepsi commercial, had he not been burned, would he have had a different life? Because the back of his head and the top of his head was burned. And right after that, he started in with all this surgery. He just did too much.
It's hard to know.
Anybody could do too much. You could do too much. I could do too much. Anybody could do too much. But I think mentally, this had a lot to do with that young man. Maybe he was already into the way low self-esteem, that's what I want to call it, low self-esteem. But low self-esteem cannot be corrected by surgery.
No, it cannot.
And I'm not a doctor, and I'm not a psychiatrist, but I believe in the gut. And when you look in that mirror, if you can sense who you are, no matter if you got a zit here or a zit there, you know who you are, and if you can correct it, fine. If not, just go and show your face.
I think you're absolutely right.
Thank you.
Absolutely right.
Thank you. It's low self-esteem.
Right. We're so much more than our appearance. Unfortunately, our appearance is how we're often judged, but we're so much more than our appearance.
We're really, really more than that, 100%.
Yep. Our job is to help women put their best foot forward, to help them make improvements they've always wanted to have, to help them get back to what's normal for them. Some of these procedures, tummy tucks, is just getting back to a normality.
Right.
Particularly for breast reconstructors, getting back to what's normal.
What they used to have before. Now, I'm sure you've had some procedures that just didn't go right. What? Want to talk about that?
We all have complications.
Yes, we do.
We all have complications. The more you operate, the more complications you have. Where our job is to stick by the patient, to make sure they're fully informed before they make their surgery decision.
It's not a consent form?
Absolutely.
Okay.
And to keep them fully informed afterwards, to be completely honest about any complications that we have and to see them through to the end.
Exactly. Are there any complications with liposuction?
Certainly, with any surgery, there's a risk of complications.
Ripples, dents, or what?
Right. The biggest thing with liposuction are the contour irregularities.
Okay.
Absolutely. And those are the ripples and dents that you're speaking of. If we take away too much fat, then the skin loses its contour. It can become dimpled or have ripples in it.
Can that be corrected?
It can be corrected in some cases.
How do you
in some
fix
cases,
it?
it resolves in its own time. In some cases, we have to go back and put a little fat back, called a fat transfer, to fill in that gap.
And where do you take the extra fat from? The buttocks, the thighs again, or what?
Wherever they have it. Most commonly from the abdominal area, the inner or outer thighs.
But I mean, if a woman has the tummy tuck and she has a lot of ripples, where would the doctor go where would you take the fat from to fix the ripples?
If a woman had a tummy tuck and then had a lot of ripples, well, that would be unusual. Because after the tummy tuck, the goal is to get rid of all the ripples, to get rid of all that extra skin. We're pulling the skin tight. So if I had a woman with liposuction alone in her tummy that didn't have ripples, then she probably needs a tummy tuck. And I've had a lot of women that came into the office recently who've had liposuction in the past and still have the extra skin and still have the loose tummy.
Well, I guess you should do the pulling of the skin at the time you do the liposuction. A lot of times people don't have that money.
That's true.
It costs more. That's two procedures. It costs more.
It is more. It is more. And sometimes you don't know if the skin's going to retract or not. But if you have loose skin as the problem, then a liposuction is not going to fix that. If your abdominal wall is loose, liposuction is not going to fix that. So a lot of it is patient selection.
Okay.
But you always have the option of going back later and tightening the skin.
But it will cost more money, but if you get what you get. You get what you ask for, and hopefully you won't have any problems.
Well, you just want to pick a surgeon who is able to offer you all the different types of procedures and not just kind of push you towards one procedure.
Right. Just don't go to somebody who's brand new, never done one before.
Well, we would hope not.
Do you know our 30 minutes is up?
That was fast.
Our time went so fast. It's been such a joy having you here. I'd like to have you back.
Absolutely.
Would you like to come back?
Sure.
Okay. And for all my viewers, thanks for watching. Until next time.